Joining me now is Dr. Jane Morgan, Executive Director of Health and Community Education at Piedmont Health. Dr. Morgan, it's so great to see you. This is
Great to
big
see you,
news.
Nicole.
How big of a deal is this test? Could it be a game changer?
This is a big deal and it could be a game changer, even though now it may not quite be ready for prime time, but it's giving us a big hint as to the direction in which science is going. We know not only with Alzheimer's disease, but all disease processes, the earlier you catch them, the more likely you are to intervene and either develop a cure and have a cure for that patient or to absolutely reverse the process or slow the progression.
Yeah, that early detection certainly is key. Do you think this test will be added as a preventative screening like so many other blood tests?
Nicole, I'm not so sure that it'll be added as a preventative screening, probably because it's cost prohibitive, but also because it really hasn't received FDA approval yet. So we need to take a look at that. We have to remember that there are still over 160 clinical trials ongoing right now in this area of Alzheimer's disease. So it is active, it is engaged. We are interested as our population continues to get older and older. And we know that amyloid plaques and these tau bodies that are in the brain that herald the onset and the progression of Alzheimer's disease are really perhaps just the tip of the iceberg. We also have to contend with the fact that Alzheimer's is not the only type of dementia. There are other types of dementias as well. And should we be focused on those as well as we see some of these other clinical trials?
And Dr. Morgan, some people just get a precautionary body scan when they reach a certain age, just because they, want to make sure that anything that could be lurking, potentially in their body is detected. Do you think a test like this could be something that maybe, if not part of the required preventative testing, is something that people could request?
There's several companies that are developing a multitude of blood tests that sort of do that body scan in a blood test, looking for specific markers to give you an indication of maybe where you need to have some additional focus by the medical establishment. Those also are not ready for prime time, but very, very, very titillating as we look at them. And you can have a plethora of blood tests done looking at biomarkers that can really determine if you have any pathological processes. In other words, illnesses developing somewhere in your body. Certainly cheaper and safer than total body scans.
And how critical is early detection when it comes to Alzheimer's? How much of a difference does it make when we then talk about potential progression?
I don't even know if I can emphasize this enough. There is no way to overemphasize prevention. And certainly our healthcare system in the United States has not really been that great at practicing prevention. And so we're hoping to move the needle in that direction. We want to do more clinical trials. We want more women in clinical trials. We want more minorities in clinical trials because prevention is really the key to a healthy society. Preventing the disease before it starts as opposed to treating it after it has started or even trying to slow its progression, we're really already behind the eight ball. We see that these drugs that are developed now for Alzheimer's disease, while outstanding, they actually only slow the progression, which is still excellent because we don't have such a rapid progression to Alzheimer's disease, but they also still have side effects. We've got a risk of bleeding, a risk of brain swelling, a risk of seizures. So prevention always, always, always is the key. Just as our grandmothers used to tell us, it's still true.
And, this may be wishful thinking. Do you think we would ever come to a point where Alzheimer's could potentially be reversed?
I think so. I absolutely think we can come to a point where we start to dial it back. So the amyloid bodies and the tau bodies, these amyloid plaques and tau bodies really are only part of the story. So we need to begin to look at neurotransmitters, which we're doing, inflammation, which we're doing. There's a whole sort of array of things that happen in the brain during Alzheimer's disease. We focused on really probably about 15 or 20% of it, but we will see with all of these clinical trials ongoing a rapid progression and understanding of the pathology of Alzheimer's disease. And hopefully it's something that we can put in our rearview mirror in our lifetimes.
So many families would love to be able to do that. All right, Dr. Jane Morgan, thank you so much.